Hey everyone, this is Per Larson with Movement RX. I wanted to talk a little bit about how to use your Tricare benefits to get physical therapy off base. It's a question that comes up quite a bit in our practice. We figured it was time to just put a video out there and help people understand how it works. So first of all, let's talk about what is Tricare. Tricare is essentially the insurance that covers military, their dependents, and their spouses, and in some cases retired. But we're going to talk about two specific forms of Tricare today, which are the most common. Prime and Select. Now, Select replaced what used to be called Standard as of 2018. Prime is an HMO type plan for active duty military, while spouses and children can choose between Prime and Select, which is a PPO type plan. Why get care off base? And that's what this is for. That's what this video is about, is how to get care off base using your Tricare benefits. And so it can be done. First of all, convenience. You may not live near base. You may live 20, 30, 40 miles away from base or some a military care facility. Secondly, specialists. There are a lot of great people in Navy medicine, in military medicine, but there's a lot of challenges because the system is burdened. There's so many people waiting to get care that you are unable to either find a specialist, or the time that you do get with your physical therapist, in our case, is 15 minutes, 20 minutes, maybe even half an hour. You want to get an hour care with your physical therapist, and that's difficult to do on base. So time with your therapist equates to quality. It's time to be able to spend to figure out what the issue is, what's the right progression, what are some things that you can do to fix it. So background set, here's 5 simple steps to using Tricare benefits to get off-base physical therapy. First, talk to your primary care manager. This is the rule. You have to go through your primary care manager to get a referral for physical therapy. The second step is we want you to ask to be referred out to a specialist. Now, there's Tricare providers who are in-network, and there are those who are out of network. We're going to talk about in-network, and that means that your out-of-pocket costs will be minimal. You want to search for a specific, if you have one in mind, a specific physical therapist or a company. For instance, us at Movement RX or our founder, Dr. Teresa Larson, both come up, depending upon the database, in your primary care manager search. So talk to your primary care manager, say, hey, I want to see Movement RX, and have them refer you out to see us. Now, typically they'll honor your request. There will be cases where they don't, but you have to ask. Once that's done, then it's out of your hands. The fourth step that happens is we get an authorization. So for instance, if you chose Movement RX, we would get an authorization faxed to us from Tricare with your information, the diagnosis, the number of visits. It's a very regimented process, but once you get it authorized, we're running and swinging. The last step, the fifth step, is that once we get that authorization, either you'll get a record of that authorization so you can call us, or we will then call you or the physical therapist or the clinic that you're looking to get into, and we'll talk. We'll figure out what the issue is, set up a time to come in and see you, for you to come in and see us, I should say, and we take it from there. Typically, you'll get about 12 visits to start. You may not need that. You may need more, and there's ways to extend that as necessary. So 5 quick steps. Primary care manager, ask to see a specialist to be referred out. Search and figure out who that specialist is. We'll get the authorization. We'll talk and get you scheduled. For your information, there are some co-pays involved depending upon the plan. Not very big, but it all varies based on your plan. We see anywhere from $0 to $30 per visit. Something we can figure out on the phone as well. If you have any questions about this, give us a call, 619-210-0945, or visit our website at movement-rx.com.